So some of you might remember last year's conference where I spoke about the star Arcturus. You guys remember that from last year? This is the star that the Hawaiians referred to as Hokulea, the star of joy. And it was the star that the Hawaiians used over 1,000 years ago to navigate to the island. And today, originally, my plan was to spend a lot of time talking about Project Arcturus. But unfortunately, everything changed for me just about 2 weeks ago. Right around midnight, I got startled. There was a loud banging at my window, and I tried to figure out what was going on, and it turns out it was my father. And he had been evacuated. His home was right around over here, and the fires were quickly approaching. Normally in Maui, there's a trade wind, and it's constantly blowing towards the direction of that pool on the bottom there. And for whatever reason that night, I'll never fully understand how this happened, we didn't have trade winds. And luckily the next day that fire was put out. Our homes were saved, my parents got to go back to their house, and life went on. But it wasn't the case for other places on the island. Around 1,000 miles south of Maui was this Category 4 hurricane, Hurricane Dora. And it created these sort of whiplashes of wind that were hitting our island in strange directions. And that particular day, instead of whipping my area of the island, it was whipping an area of the island called Lahaina. And it completely destroyed the city in a way I've never witnessed before in my life. The entire city was decimated within 2 to 3 hours of a fire starting. They called it a fire hurricane. And that's what was described on the ground. It just whooshed in at 1 mile a minute and completely destroyed the entire city. Over 2,000 buildings were destroyed. Over 4,000 people completely lost their home and everything inside. And they're saying as many as 1,000 people were killed. There was no warning. The people of Lahaina had no way to know this was happening. Honestly, one of the biggest tragedies in all of America. The deadliest fire in the history of America. And the island of Maui is suffering. I went to a shelter a few days after this where a lot of the displaced people were living. And outside the shelter, they had a whiteboard with all the top priority needs sort of listed in order of priority from top to bottom. And the topmost item, above food and propane and batteries and toiletries and clothing, was mental health. You know, the people of Maui referred to family as ohana. Ohana is the name, but it's not used in the way that we think of traditionally for family. Ohana is really your extended family as well. I spent many months coaching my kids in different sports, and all the other players on the team wouldn't refer to me as coach, they referred to me as uncle. So the word ohana in Hawaii is really about your extended community, which is also part of your family. And on this day, they lost everything. About 2 to 3 days into this, I kind of entered a moment of despair. It was really hard to handle. I felt helpless. I wanted to give back. You know, we were donating food, we were donating clothing. I brought my family to help feed the firefighters. But I really felt this ominous feeling. You know, the island, the government, they were thinking about things like food and shelter, right? This was their top priority. But on my mind, I was thinking about what are the mental health ramifications of this. Even before this fire, Maui had very limited resources when it came to mental health. We had very few professionals who actually could help people with severe mental health issues. Oftentimes, if your issues were severe enough, you would have to go off island. And now here we are, one of the worst tragedies to hit this world, and we have no help from a mental health perspective. So I started racking my brain. It got to the point where I was actually thinking of not coming to the Float conference. To me, I felt like I had to help this community somehow, and I didn't know how. And then about almost a week ago, I had an epiphany. And I said to myself, all right, I have to come to Float conference and share this epiphany with my Float Ohana and get your guys' feedback. I'm excited about this idea, but it's a dream, it's a vision. I think it's a revolutionary idea if we can make it come true. And I think it's the type of idea that could actually save this island. So let me take you through my thinking. And it starts with a study that we published over 5 years ago. It was the first float study done in people across the spectrum of anxiety disorders. And these are showing the effect sizes. And I'm highlighting here the column showing all the patients who had post-traumatic stress disorder. And what you should notice is a profound, very large reduction in state anxiety, a reduction in stress, a reduction in muscle tension, depression. It was a very effective float session for these patients who had PTSD. And these were all large effect sizes. And this was one of the first indications that floating could really have an impact on somebody who's suffering from post-traumatic stress. Earlier this year, not that long ago actually, we published another study, and we showed that these effects actually persevere for over 48 hours. So it wasn't just reducing stress and anxiety at the moment of the float, but it was actually carrying forward for over 2 days. This was the first demonstration of anything of this kind, and it shows you that there's something very important happening in float. There's a residue that doesn't just carry forward a little bit, but it actually goes forward into the next day and the day after. The truth is, even at 48 hours, we were still seeing significant effects. We should have gone out to 72 hours or even longer, right? So we actually don't know the full extent of how long a float session's effects last. But this was promising data once again, and it showed that in patients, including patients with PTSD, and it wasn't just people saying that they felt better. We were seeing these changes in the brain and the body. You guys might remember Dr. Joel Froelich last year at the conference presenting the first float EEG data, where we were able to measure brain waves. And in these same patients, including patients with post-traumatic stress, you see this dramatic slowing of brain waves. You could see highlighted there in red, the area of slowing is down to a trickle. We're talking about 1 to 2 cycles a second. They call these delta waves. And the fact that floating was able to induce this, even though all the patients remained awake and conscious, is a very novel finding. And we looked at other signatures. We looked at heart rate variability, and we showed improved heart rate variability in the high frequency spectrum. We also looked at things like respiration, and we saw this slowing of respiration, just reflexively triggered by the environment. And the biggest effect that we found out of all the variables was blood pressure, especially diastolic blood pressure, where we saw drops upwards of 10 to 15 points during the float session. So you have to realize this is a very important set of findings when it comes to post-traumatic stress, because one of the core symptoms is what's known as hyperarousal. And what these data are suggesting is that without any effort on the part of the patient, floating is reflexively reducing autonomic arousal. So to me, we have now objective data that floating could help people who are suffering from post-traumatic stress disorder, and it could also help their entire nervous system and body come into a state of equilibrium, which is really what they need, right? The whole idea of post-traumatic stress is you're carrying the stress forward past the trauma. You're still experiencing life as if you're in that traumatic event still. So it got me thinking, okay, we have good data to support the idea of using floating to help the people of Maui with post-traumatic stress. But how? How could we rapidly deploy flotation therapy to the people of Maui and make it accessible to everyone who's been traumatized by this horrible fire? We're an island of about 150,000 people, and there's not a single float tank on the entire island. To me, that's a travesty. This is the island that John Lilly spent his last days on. This is an island surrounded by water. It's really something that the whole population of the island embraces. So it seems to me that float therapy should be there as well. But now we have a ticking time clock, right? We have a traumatized population. There's nowhere to float. How could we solve this issue? So this past week, I've been on the phone. I've been talking to people. And luckily, my engineer, Colin Stanwell-Smith, and his son, Toby, have devised, I think, a brilliant solution. They're calling it deployable float modules. These are going to be 40-foot shipping containers that you could prefabricate float tanks inside, ship them across the sea all the way to Maui, and plop them down anywhere that there is a good solid piece of land that has electricity hookup and water hookup. And when you actually look at the capacity, we could have over 20,000 floats a year in one of these modules. And if we could have multiple modules, we could be floating thousands of people every week on Maui. So the way it works is each room has its own private door. On one side of the container, you have all the filtration equipment. There will also be a very basic HVAC system to clear out the humidity that's built up inside. And these are all going to be rectangular open pools to help reduce the claustrophobia that people with post-traumatic stress might have. So essentially, the door will open here. They'll step in, they'll have their own shower, and then they'll have a nice, spacious, rectangular float pool to float in. Here's the part that I think is revolutionary and could completely change the way we think about how people access float therapy. My proposal is they don't pay anything. The price of a float session is $0. It's completely subsidized and taken care of for the population of Maui. And you might ask, how the hell are we going to do that? Well, I think there's actually a way that this is possible. Firstly, these are shipping containers. They could go anywhere. Right now, the people of Maui are coming together. They want to help. So the idea is we're going to find a piece of land or multiple pieces of land that are going to be rent-free, where we could just put the shipping container onto it. And that reduces a lot of the overhead right there. We've been crunching numbers all week. I had my treasurer, Andy Larson. I had Brad Dock, who's created a very intricate calculator for how much it costs to run a float center, going into all the nuances from electricity and water bills to how much earplugs cost. And we basically ran the numbers for how much it's going to cost to build this and ship it across the world and run 20,000 free float sessions over the course of a year. And I think the number is totally feasible. It's 500,000. So I've already applied for several grants through philanthropic organizations in the state of Hawaii. I'm in talks with various levels of government. And I think this is a very tractable figure for them, especially when you look at how massive this disaster really is. They're saying upwards of $6 billion just to rebuild. So this is a drop in the bucket, but it could have a profound impact on the mental health of the island. And it's not just the data I showed you earlier that makes me feel that way. I think there's something inherent about the relationship, the antagonistic relationship between water and fire. In many ways, water is the antidote to fire. And I was really pleased to speak to a float center owner at the conference this year who owns a center in Washington, D.C. And for the past few years, the International Association of Firefighters has been sending their traumatized firefighters to float at his center. And they have reported to him that this is an effective way for them overcoming the stress of firefighting. So I think there's something so important here about floating when it comes to helping people overcome the horrible nature of a fire trauma. So this is my idea. I want to save the people of Maui one float at a time. And I want it to be completely free. I don't want them to have to pay anything. If somebody wants to float every day and there's openings in the schedule, they could float every day. If some people want to float once a week or once a month, fine, they get to select. It's totally free. We're going to make it as easy for them as possible. And one thing I should mention, in all of those studies I showed you with people who had post-traumatic stress disorder, we didn't have any added psychological component to that. We didn't offer them therapy or counseling. We were just there monitoring. So in other words, we don't need licensed mental health professionals, which is what the island is really lacking right now, in order to facilitate this. The float environment could do all the work for us, and it could potentially reduce this profound hyperarousal that many people are facing at this moment. And to me, what is most exciting about this is it's the first real-world test of whether float therapy can help prevent PTSD. And it's not just PTSD, but all of its horrible comorbidities, depression, suicide, addiction, insomnia. These are the things you see oftentimes with PTSD. So we're going to be able to actually look at this and see in a large sample of people how well their outcomes are after a year. And we could compare them to the outcomes of people who did not utilize the float therapy but were still traumatized. And of course, my prediction is that all of these symptoms and diagnoses are going to be significantly reduced by the people who are able to access float therapy. This could completely change the way we deal with trauma in this world. If this works, you're going to see FEMA coming into a disaster, and right behind FEMA is going to be half a dozen or more float containers with a bunch of Epsom salt, and wherever there's a disaster in the world, this is how we're going to have to deal with it, using a very natural intervention. You know, what worries me is without any mental health professionals, I believe the current response for the island is just to medicate the population. I don't want to see all of the people on Maui addicted to opioids and benzodiazepines walking around like zombies because they're trying to numb their pain. I would much rather them be floating, have a very natural way to put their nervous system back into homeostasis, and have none of these horrible side effects and none of the addiction that comes with these drugs. To me, this is a much safer solution. But the clock is ticking. Chronic PTSD starts as soon as 6 months after a traumatic event. So every day, more and more people are going to be heading in that trajectory. And chronic PTSD is horrible. When I worked at the VA hospital, I remember working with a veteran from World War II. And 60 years after the trauma from World War II, he was still waking up every single night in a cold sweat, the same nightmare again and again and again, 6 decades straight. So when I say chronic PTSD, this is lifelong. That's what we're trying to prevent here. So time is of the essence. I'm really excited to be here because I'm sure all of you guys have clever ideas of how we could expedite this even further. But my goal is within the next few months to try to get one of these shipping containers on Maui and start floating people ASAP. We can't wait any longer.